Thanks for having me. I'm Cindy Feaster with Linn County Public Health. So I'm here to talk about health insurance overall, the marketplace. I'll touch a smidge on Medicaid, and then Medicare, and then how you can help people get in touch with any one of us. We actually have a really large community collaborative. Mercy is part of that, Unity Point as well. KCAP, Iowa's Insurance Navigator Office, and a number of other individuals who come together under the healthcare access focus area of Linn County's Community Health Improvement Plan to help people get and keep health insurance. So if you are interested in working on this at all, get a hold of me. My card's on the back table. We take any and all volunteers to help spread the word in the community. And we'll give you information and you can run with it. And I'll give you some examples of that here in a second. So, all right, so what I hope you will take away from the short time I will be speaking is that there are some guidelines around the Affordable Care Act. Open enrollment is just about to start. So this is people's opportunity to sign up if they're currently uninsured and over Medicaid guidelines. We'll go over some of that in just a moment. Medicare, I am not a SHIP counselor. I will make that very clear right now. But I know just enough information to be dangerous, and I will refer you to a SHIP counselor. They are available in either one of our hospitals here, and there is a statewide office too and a website. So we encourage people who have any kind of Medicare-related questions to talk to a SHIP counselor. Okay, so the Affordable Care Act is also nicknamed Obamacare. People may also call it the federal marketplace in the state of Iowa. Iowa does not have a state-based exchange, but we do rely on the federal insurance marketplace for people to apply for health insurance. So the first thing I like to caution people about under Marketplace Basics is that the only legitimate website for the Affordable Care Act is healthcare.gov. Open enrollment is coming up, starts November 1st and runs through January 15th. This is a time during the year when people do not have to have any kind of a special enrollment period, and they can go sign up for health insurance on the marketplace, and that insurance would start January 1st. Unless they pick it after the start of the year, then it would be February. And then just to clarify, there is very good information on healthcare.gov about what types of immigration status qualify for health insurance. I can't emphasize that enough. Iowa did expand Medicaid to working able-bodied adults is what the term is. And when they did that, they made it so that newcomers to our country who have been here less than 5 years and are otherwise banned from having Medicaid can get health insurance through the marketplace with a very heavy tax subsidy tied to it. We meet people all the time that are misinformed about this, and it's really unfortunate, but we want people to come and see us and truly find out what they're eligible for. Now, special enrollment periods are something that, if you're working and you're in a job and you need to make a change to health insurance, it's the stuff that stops you in your tracks and you're like, I probably need to go report that to HR so I can add somebody to my policy or take them off or make a change. It's a special enrollment period. This happens throughout the year, but you're entitled to a short period of time, usually 60 days before the event or 60 days after, in which you can make a change to a marketplace plan. So if you have a divorce, a birth of a baby, you get married, something of that nature, you can make a change. If you lose your job and you have job-based health insurance coverage and you need health insurance on the marketplace, that opens a special enrollment period too. We don't want people waiting on that though, because the federal government has made a few changes to proving eligibility for special enrollment periods, and it now takes us a little bit longer to get insurance started. So it used to be that you could start the insurance right away when you said you're eligible, and you had like a 90-day window of time in which you could submit your proof. And then if you weren't eligible, your insurance stopped and you had to back of a tax credit, that type of a thing. But now they make you do all that stuff ahead of time. So it is really, really important to stay on top of things, and get that in place. It's critical, and we don't want anybody going without health insurance or gap in their care. They lose a job and lose their insurance coverage. We also do what's called a prepare screening to ask a few more questions, because we find that people and families are often like icebergs. They call us for one thing, like they need help with health insurance. But if we ask a few more questions, we find food insecurity, maybe they need some clothing, a better job might be a great thing, so many things. And we are a really resource-rich community. And using the technologies that sits behind this QR code, we can send a referral very easily from one agency to another. What I will say is that as of earlier this year, that column that said Medicaid for pregnant women has dropped substantially. And I will tell you right now, we get comments and calls all the time. There are a lot of people who had their last pregnancy covered by health insurance and maybe Medicaid as a secondary to cover their giant deductible. And now, unless your income is below these thresholds, it's not available anymore. So there are a lot of families out there that are probably going to be saddled with some pretty significant debt after having babies. Now, the thing is that was the concession that was made to extend Medicaid 1 year postpartum for moms. It used to be 6 weeks, 6 weeks, and you were done. So the concession was we're lowering the income guidelines way down and extending 12 months for mom after giving